Welcome back to our psychology series here at the Project Return online classroom. My name is Elizabeth Keel and I'm your program manager. And today we're going to be continuing our discussion on mental health and mental illness by discussing first the differences between the two. Now, often mental health and mental illness are used interchangeably to describe the same thing, the way we think, feel, and behave, and our psychological, our social, and emotional well-being. And if you say you are you have mental health or mental illness, then that really only provides two options. And not everybody necessarily needs a diagnosis or has a diagnosis of an illness. And so the first thing to remember is from our stereotypes and stigma video, where we discussed about some of the common stereotypes about mental health and mental illness. And the first one is that mental illness isn't always present. It's episodic. Just like arthritis pain is episodic. It doesn't always flare up to the same degree of pain. It's the same thing with depression, anxiety, mania, and positive negative symptoms associated with schizophrenia. And so they're episodic. And mental health is mostly changes based on circumstances. So I have a few examples for you first, but just remember that mental illness is when an illness impacts the way we think, feel, and behave. If we have bipolar disorder and we experience mania, it's going to change the way we think, feel, and behave. Alternatively, mental health, if you are a runner, for example, and you get injured on the field, and because of your injury, you get really angry at your coach and your teammates who don't come around. You get frustrated with your spouse who's not, as emotionally supportive of you as you would need in that time. And then from all the isolation and the injury, you have low mental health. Now, you wouldn't say necessarily that this person would be diagnosed with major depression because of the injury, the circumstance behind the mental health issue. And so here's another one. Someone is diagnosed with bipolar disorder. Let's say Mary. Mary is diagnosed with bipolar disorder, but she has experienced mania with psychotic features. And so but she also manages to have a really good job, a marriage, and close social family networks and respect from her community. Now, you could say that due to her diagnosis and experience with mania and psychotic features, that she has a very serious mental illness that influences and impacts the way she thinks, feels, and behaves when it occurs. You can also say that she has really, really high mental health in the fact that she functions extremely well and is successful despite the illness that she has been diagnosed with. And then the last one I will give you. A gentleman, we'll say his name is Mark, is undiagnosed with ADD or ADHD. And he struggles with his schoolwork all the time. And he goes to his school counselor and she recommends that he see a psychiatrist, is diagnosed with ADHD, and begins medication. And then once medication begins, he must then undergo therapy to understand the anger and resentment that he's formed over the years that contributed to his inability to succeed at school. And part of that is due to his ADHD. So you could say that he needs first mental illness treatment because he has ADHD. And then also that he needs mental health treatment because of the anger and the frustration and the poor coping mechanisms that he acquired due to his failure to thrive at school. And so those are some examples for you. Some examples I found on the internet that are great to really understand the difference between mental health and mental illness. So hopefully that's a little clearer for you just to start. And so the next thing we want to talk about is the biology of mental illness and the stigmas of the different names that have been used to describe mental illness. So first, what are some of the things you've heard to describe people with mental illness? That they're sick, that they're crazy, that they're insane, that they have a brain disorder, a chemical imbalance, that they're crazy. We also have more kind words, such as brain disorder, neurological disorder, or mental health challenge. And all of those things can be hurtful, but they can also be helpful. In the case of, brain disorder, we want to challenge the stereotypes and the issues that are present when people don't understand the basics of biology behind mental illness. And so the biology of mental illness and heart disease, let's talk about the two. So for example, if you have a sore throat, you're going to go to the doctor. If you break a bone, you're going to go to the doctor. If your mental health, for instance, is really, really poor, you would go to the doctor and say, my mental health is poor. You may then be diagnosed with a mental illness, and that can be a psychological problem. And the illness oftentimes is a structural neuroanatomical issue, in addition to chemistry. So we have to think about the medicine as treatment for that illness, just like we would treat the flu with a Z-Pak, or we would treat heart disease with, high cholesterol with a statin, we'll say. So lots of different things that we have to consider when we think about the biology of our health, the biology of our brain, which determines the way we think, feel, and behave. So when we say we have a brain disorder or a chemical imbalance, we're talking about the brain, and we're talking about that system in the same way that we would talk about cardiovascular health. And so what does taking care of your mental health look like? And that's the last thing we're going to discuss for today. What does taking care of your mental health look like? Well, if you have a diagnosed mental illness, you still have the opportunity to practice all the mental health techniques we're about to discuss. And so don't forget that this is an opportunity for you too. Don't check out just because we're not specifically talking about mental illness, because you can benefit and anyone can benefit. Everybody has mental health. Either good or bad, happy or sad, everyone has mental health. So what does taking care of that look like? Well, right now with the coronavirus, we're all being told to isolate and stay at home, and that's really tough. So we've got to work through that. And part of that could be accepting and enjoying your time alone. How do you make your time alone something that is satisfying for you? Being with other people, accepting help from other people. Being there for others is a great way to express your gratitude for someone. And we talked a little bit about gratitude and how an attitude of gratitude can help you thrive. And then other things that can take care of our mental health. Sleeping, eating right, very important for our mental health. And doing something that you're good at. Find something that you're good at. I know a lot of you like to knit. I know some of you crochet. I know a lot of you paint, draw. We have a lot of outsider art going on at Project Return. So do something that you're good at. And if you're feeling really down and you feel like there's nothing you're good at, go revisit your gratitude journal. So Project Return and anyone else who may be watching, thank you for joining me. I hope you enjoyed this discussion about mental health and mental illness, and that you have a clear understanding of the distinction between the two. So join us for the rest of our psychology series, and enjoy the rest of your day. Take care, everybody. Until next time, see you soon.